Hello. Okay, so this video is going to be about pre-transplant testing. So after you have gone for your initial consultation and you've done all your blood work and everything and they found a match for you, they will send you up for pre-transplant testing. It's a lot shorter and a lot easier for Crohn's patients than I've heard for like MS and stuff. I heard there's this little bit backwards, like their consultation's a lot easier than their pre-transplant testing. But anyway, so this would be your second trip up there. And what they do is he has a few different nurses. Mine's Paula, and I know there's a few other ones. I think Paula deals mostly with Crohn's patients, and he has some other nurses that do a little more with like MS, and then he's another Crohn's patient, another nurse for like RA and so forth and so on. They might cover a few other random things, but anyway, they'll send you up for about 2 to 3 days, depending upon how they can cram pack your schedule. So when you go up there, you're going to get I had to get a chest x-ray, and that was scheduled. I had an appointment. And then I went and I got a 2D echo. I got that. I got blood work. When they draw your blood, they draw like 20 or more vials of blood, which may seem like a lot, but it's not. It's not. And I know it was a little scary when I first walked in there because I've had a lot of blood drawn, but never 20 vials in one sitting. But I really didn't. I didn't faint. I didn't bother me whatsoever. It's only a few tablespoons, they say. So they do that. They do a pulmonary test, an EKG, and EKG, pulmonary test, 2D echo, blood work, and a chest x-ray. So that's what they did. And they scheduled that for me all in one day. I know the EKG and blood work doesn't need appointments. The other three, they did book appointments, so I had to squeeze it in between. But they're open really late. Like, I think they were open till like 6 or 7 at night. So, and I started at 12. So it wasn't bad at all. And then after that, we had, the next day, we saw Dr. Burt. He normally sees everyone on Wednesdays because Tuesdays he's in the hospital doing, visiting the patients that are already in there for their transplants. So we met with him and we went over the match that we have, and they have to do the process now where now that they have all the test results and everything was fine and healthy and all that, they apply for insurance, and that should be about 2 weeks, they said. It could be a little more. Then they said when they're going to weed through the donors, because I have a 5 of 6 match and not a 6 of 6, they are going to pick the 5 more important ones and leave the one that I can do without, obviously, out. So with that being said, once they look through them and they're going to pick out the ones that have the most stem cells in them, they're going to have them shipped because they come from all over the world. It's like a huge thing, and like people donate into it every day, and so they have them like shipped from wherever they're coming from, which could be France or Italy or wherever. And then once they get them, they do some testing on them. I think they clean them up and they, run some of their own tests on them to make sure it is what they want it to be. And they usually choose 1 or 2, depending if you have enough like donor matches for that, so that they can flood your body with stem cells, because it's just better like to have more than to have like 2 stem cells and put in your body. It's going to take forever to multiply and build your immune system. So they do that. So they said when that's all done is when they can, I guess, start booking my dates for the transplant. But the only problem is it's April right now, and he doesn't do transplants like in like May really, because he's going away to speak at the end of it. So I have to wait either till like, well, they're probably booked up in June because everyone who's already getting all their information now is scheduling for June, and then I'll probably be like July-ish, they said. So that's what they do with that. When you get the test, like, because I didn't know what half of them are. Someone told me I was going to get, like, a stress test and, like, well, this other stuff. It was really simple. It was a lot easier than the first consultation, obviously, with the colonoscopy and the MRI. It was just a chest x-ray, which is simple. You just stand with the little board and stuff. There was a 2D echo, which was when they take a sonogram and they just put it over your heart and they look to see if your heart's flapping right, and you can see it on the screen. It's really cool. And then they also will give you an IV and they'll pump a little syringe of saline in it, which is just is basically like salty water. It's what they use to flush out IVs and stuff like that. And it doesn't harm you at all. It's basically like water. No dye or anything in it. And what they do is they'll pump it in your arm, and then it goes instantly, like almost into your heart because it's through your vein. And you see on the sonogram it fill up. And they look to see if there's any leaks inside of it, because I guess if there's leaks, they have to like consider some things. They might not be able to do it. I don't really know because I didn't have any. So they just were looking for some leaks. And then once they didn't find any leaks that way, they had you like hold your breath or like tighten your stomach to see if like any of the pressure would push against, and maybe that would make it seep through, because there's two sides of your heart and they want to make sure they're not leaking through to each other. So they do it a few times and everything was fine. So that was cool. I've never had that done. And then obviously 20 vials of blood, is most people have had their blood drawn. Then they do a pulmonary test, which if you have asthma, I have asthma, it's just like that breathing thing that you blow into to see how strong your lungs are. But it's kind of a little different. I mean, it's the same concept. You blow into this little machine, but it's in a little glass box, and they do a few different breathing exercises with you to test how strong your lungs are. And like they close off the machine, so it feels a little weird, like you're blowing into like nothing almost, and it's like pushing on your lungs. So I guess it's to test how strong, and if your lungs are gonna, I guess, like fatigue when they have pressure. I don't really know, but it's something like that. So they do that, and then they have the EKG, which is just when they put little things all over, and they put the like little stickies, and they put wires attached to them, and it takes like a minute, and they just run something through the machine, and it prints out all those things that go like this. You know, what you see like in the movies when someone's heart goes flat or whatever. It's like one of those little things. So that was really simple and really non-invasive. And then obviously the appointment's the appointment. And I didn't know what half of these tests were, so I had to look them up online, and then I kind of guessed what they were going to be like, and then I went into them. The things are that the chest x-ray is pretty quick. The pulmonary test takes about like 20 minutes because you're doing all these different exercises. The blood work, it takes probably like 10 minutes because you obviously have to be called in and sat down where they collect all the vials. But if you're pretty hydrated and stuff, the blood should come out pretty easy, and it shouldn't take long. And then the EKG only took a minute or two after she set it up, which only took a few minutes. And then the sonogram thing is what took the longest because they have to take pictures and they have to get it from all these different angles around your heart. So I was probably in there for like maybe an hour, give or take a little. And that was the like longest out of everything, and then however long your appointment's gonna run. So I hope this prepares you and gives you some insight on what you're going to be going through during your pre-transplant testing.